Another day, another complex case. Mrs. Rodriguez needs a full mouth reconstruction. Implants are the ideal solution, I know that. But can I really give her the best outcome? Do I have the training or the experience? It feels overwhelming. Maybe I should just refer her out. It's easier, right? Referring is the safe option. The patient gets the care that they need somewhere else. But what about my growth? What about the satisfaction of providing the complete care myself? Eventually, I didn't go to dental school to just be a gatekeeper for complex cases. Wait, what's this? Unlock implant skills? By referring a case? Patient-funded education? This sounds different. This is incredible. I'm not just referring the case away, I'm using it as a springboard to finally gain these skills. The instructors are fantastic, the hands-on time is invaluable, and seeing my own patient's case progress gives me context I could never get by just referring.